leeches, burning plasters, Mercury bath. In Tudor England, medicine meant rebalancing the four humours: blood, phlegm, black bile, yellow bile. Sometimes the cure helped. Sometimes the cure hurt more than the disease. 7 real remedies, exactly how they worked, why people believed them, and what they did to living bodies. Receipts, not rumors. History, not horror for its own sake. And one question at the end: were they foolish or using the best logic they had? Before our list, the map. Doctors read bodies by temperament: hot, cold, moist, dry. Fever, too hot. Melancholy, too cold and dry. Treatment tried to push the body back to balance through blood, sweat, vomit, urine, tears, and the skin itself. If you fell ill, who did you see? Physicians, university men with Latin and law on their side, took pulses, inspected urine in glass, and wrote careful prescriptions you might struggle to afford. Barber surgeons worked with steel, bleeding, lancing, stitching, setting bones. Their striped poles promised action as much as remedy. Apothecaries compounded the world: jars of roots and resins, syrups for the chest, powders for the belly, Theriac for those rich enough to ask, without blinking. And at home, the still room, usually a woman's kingdom, kept receipt books of rosemary waters, soothing electuaries, and poultices that comforted when coin was thin and the road to town was long. Care was a marketplace. You chose by price, distance, trust, and by what your family had always done. The flagship cure. When heat rose and pulse raced, physicians ordered blood away. Venesection, a neat cut at the elbow, ankle, or behind the ear, let hot blood run into a bowl marked in ounces. Charts showed a vein man, little lines and stars advising which vein to open for which complaint, sometimes even which days the zodiac favored. Leeches were the gentler tool. Apothecaries kept them in glass jars, cool and dark. Set at the temples for headache, under the jaw for throat, behind the ears for fever, they drank until swollen. Brine or smoke persuaded them to let go. Why it made sense then: if diseases heat, cool the furnace. If pressure builds, let it out. Patients often felt immediate ease. The throb softened, the face cooled, the room steadied. What it did to the body: weakness, dizziness, infection. Repeat bleedings left people living on the edge of faint. Winter made it worse. A rough hand cut too deep, a dirty lancet invited fever in the name of cure. Cousins to bleeding, cupping, and scarification raised angry circles and scratched lines to draw bad humors to the surface. Some swore by it. Others quietly declined a second time. If taking blood cooled fever, what if doctors tried taking the skin? A cure that still stings by name. Cantharides, powdered blister beetle, mixed with oils or wax and spread beneath a plaster. Hours later, a blister rose like a pale moon. The fluid was cut, drained, and, so the logic went, poison vented. Surgeons called it a flying plaster because it seemed to make illness take flight. Why they believed it: bad humors lurk under the skin. Raise a blister, prove they're out. Sores weren't failure. They were evidence the body had expelled its enemy. What it did to the body: chemical burns, infection, lasting scars that could ache when rain arrived. Placed near the kidneys, cantharidin inflamed where it should never go. Swallowed as a stimulant, yes, they tried. It became a quiet killer. People endured it because the logic felt unarguable. See the blister, see the cure. The plague of courts and beds, the pox, the severe mercy offered. Mercury, ointments rubbed into the skin, fumigation in heated boxes, like wooden closets where vapor rose with the reek of metal. Attendants listened for retching and spit. Physicians watched for salivation, believing the body was purging its poison. Why they believed it? If an unseen toxin entered by touch, sweat it out the same way. When sores eased briefly, the cure took credit. When patients slept, opiate syrups and exhaustion took some pain away. What it did to the body. Ulcers widened under the salve. Teeth loosened, gums bled, hands trembled. A metallic taste haunted the mouth. Breath whispered of coins. The pox often returned angrier. The cure always left its mark. In a world without penicillin, risk looked like hope, and hope is its own anesthetic. If metal could heal, what about a medicine cabinet the size of a banquet? Part medicine, part myth, part show, Theriac or Venetian Treacle. A paste of dozens, sometimes dozens of ingredients. Opium for calm, spices for warmth, honey for life, and yes, a pinch of viper for authority. Apothecaries aged it like wine. A 10-year jar could cost a small estate. To open one before a noble was theatre. Aroma, color, confidence. A spoon after fright, after cold, after shock, after poison. It tasted like safety. Why they believed it. Antiquity blessed it, Rome praised it, Venice perfected it. If evil humours roamed, Theriac claimed to tame them all. And when a rich neighbour survived, the jar seemed to prove itself. What it did to the body, the opium soothed pain, sometimes too well. People slept through danger and woke with need. Bad batches made bodies worse. Counterfeiters stretched spice with chalk and sugar. But the story of Theriac stayed sweet. Court magic in a gilded case. Bezoars, stony lumps from animal stomachs, sold as antidotes to poison. Unicorn horn, really narwhal tusk, was carved into cups or ground as a charm. Princes performed tests at banquets, wine poured into horn-rimmed goblets, while courtiers watched for omens of safety. Why they believed it, rarity promised virtue. If a stone survives a stomach full of hazards, it must neutralize yours. If a horn comes from a creature few have seen, it must be holy. Merchants arrived with tales from the North Seas. Kings priced the stories into policy, what it did to the body. Mostly placebo at royal prices, though some materials did bind tiny traces of toxins in cups, just enough to feed the legend for another century. Amulets comfort when courts whisper of poison. Comfort is a kind of medicine too, expensive and unreliable. When charms failed, healers reached for what every household could provide, however foul. Yes, exactly what you fear. Urine, thought sharp and cleansing, was used to wash wounds, rinse mouths, and brighten teeth. Dung, animal droppings, became poultices to draw out heat and pus. Mixed with herbs and tied with linen, it made a poor family's pharmacy. Why they believed it. Fresh urine looks pure and stings. Surely it scours rot. Dung is warm, warmth draws. Add rosemary or mint and a whispered charm. The patient feels cared for, which often helps more than the mixture. What it did to the body, at best, nothing. At worst, infection. Ammonia numbs, bacteria do worse. Teeth scrubbed with sharp salts and stale fluids lost enamel and dignity. But where apothecaries were far and coin was thin, people used what they had. Care is a verb, it happens with what's within reach. A freshly killed pigeon, split while warm, applied to a bubo in plague, a venomous bite, or a wound that would not close. As the bird cooled, another was fetched, a cycle of warmth and hope. Why they believed it. Warmth comforts, warmth draws. Surgeons claimed the bird's life. Heat leached the poison, some even read the pallor of the cooling flesh as proof the danger had moved. What it did to the body, comforted with warmth and nothing more. Invited infection with every new cut and contact. Replaced again and again until the patient gave up or fever decided. Families tried it because doing something is easier than watching nothing happen. Not every cure came from a shop. Kitchens doubled as clinics, ale warmed with spices for chills, vinegar and honey rinses for throats, Possets thickened with egg for strength. Still rooms distilled rose and rosemary waters. Beeswax and oil became cold creams for chafed skin. Linen, always linen, was the cleanest tool most families owned. A neighbor knew which leaf soothed, which root burned. A midwife carried generations of hands-on skill. A cunning woman added charms that calmed the mind when nothing else would. Among the frightening cures, there were quiet good ones, and people remembered those too. Sickness was also arithmetic. A barber's leeching might be cheap, a physician's visit could equal weeks of wages. A jar of fine Venetian Theriac was a luxury in a room that still smelled of cabbage and smoke. Families bargained with coin, with goods, with favors. Sometimes the church poor box helped. Sometimes neighbors did. Choices left marks you couldn't see. Repeated bleedings meant fewer hours in the field. A cheap cure that failed meant a dearer one tomorrow. Even the right remedy at the wrong time could cost a season's income. When we judge the past, remember, people weren't chasing pain. They were trying to buy back time for a child, a parent, a queen. It's easy to laugh backward, harder to see the logic. They were not fools. They noticed patterns. Fever breaks after sweat. Pressure eases after a vein is opened. Pain quiets with opiates. Warmth soothes. They lacked microbes and molecules, not attention. There was good medicine too. Willow for pain, honey and alcohol as antiseptics, real skill in binding fractures and cutting out rot. They triaged plague with terrifying courage. They learned which neighbors to isolate and which to comfort at a distance. The tragedy isn't stupidity. It's that good observations lived inside bad frameworks, and frameworks are hard to replace when they organize your whole world. Stand back and the shape is clear. Purpose: rebalance a body nudged off course. Tools: blood, blister, sweat, purge, charm, warmth. Cost: weakness, scars, heavy metals and soft tissue. Comfort traded for hope. Result: a medicine that sometimes helped, sometimes harmed, and always tried to do. Were the cures cruel? Most were earnest. Families carried mothers to barbers, queens to physicians, children to apothecaries, because doing nothing felt like betrayal. 7 Tudor cures. Each with a reason, each with a price. If beauty could poison a queen, medicine could punish a patient. And both were attempts to keep life steady with thin margins. Next episode, how Tudors used the toilet and the jobs that cleaned it. Chamber pots, gong farmers, cesspits, and the smell of power. If you're inside the playlist, the next file opens now. If not, start the Tudor Poison and Power Files playlist and follow the evidence. History remembers what it is told to remember. Today, we remembered what pain looks like when it's trying to help.